Abdominoplasty or a tummy tuck is a procedure which can radically transform the patient's appearance and their body confidence. But the biggest problem the patients face is regarding the timeline of recovery, because it's an extensive procedure and the recovery can be a little extended when compared to a simple liposuction. So I want to clear doubts regarding the recovery of an abdominoplasty in this video. Hello, my name is Dr. Arjun Handa and I'm a body contouring surgeon at Handa Aesthetics and Plastics. So in an abdominoplasty, essentially we do liposuction, we cut out all the loose skin present in your abdomen. There can be different forms of abdominoplasty, right from a mini abdominoplasty to a standard lipoabdominoplasty to an extended lipoabdominoplasty, and then something called as circumferential truncal body contouring procedures. These differ in the amount of skin excision and amount of lifting that we are providing to the body. Depending upon the amount of loose skin the patient has and the amount of deformities present in different areas of the body, we can suggest one or the other procedure to the patient. The recovery for all these procedures is essentially the same. Well, starting from the post-operative period, you need to stay in the hospital for maximum 1 or 2 days. If you have some comorbidities, then your surgeon might advise you to stay as an inpatient for a longer period of time. But for most healthy patients without major comorbidities, usually not more than 1 or 2 days of hospital stay is required. In the post-operative period, we ask the patient to wear a compression garment for a month. Now, this compression garment is essential to contain the swelling and prevent a complication called as seroma, where a fluid may accumulate below the skin and cause certain complications. So it's very essential that the patient wear this garment for 1 month. Now, if you're going to wear this garment below your clothes, then it's not really a problem. But if you're planning to go at a place where you would want to wear something like a bikini or a beach clothes, then a garment might not be the most appropriate clothing. So you may need to postpone your travel plans accordingly. Apart from that, you will have pain for about 7 to 10 days. Now, this pain is primarily due to the muscle tightening that we have done inside. So it takes around 7 to 10 days for most of the soreness to resolve. After 10 days, you will still have some discomfort, but you will be quite functional and you will be able to carry it in your stride and not be bothered by it. It's very important to remember that after a lipoabdominoplasty, you do as less rest as possible. The reason is because of the increased intra-abdominal pressure, it may predispose you to develop deep vein thrombosis, that is clots in the legs veins. Now, if this happens, those clots in the veins can actually break off and then travel to your heart, lung, and brain and cause various serious complications. So we want the patient to remain hydrated. We want them to be mobile. We don't want them to be stressed out or exert themselves, but be mobile as much as they can so that the legs keep on pumping blood back to the heart and there is no venous stasis. Apart from that, you should eat a high protein diet, you should not smoke, you should not drink alcohol, because all of these are confounding factors in the healing process of a lipoabdominoplasty. There is something called as a lymphatic drainage, which is done by a physiotherapist. Now, this therapy decreases your swelling, decreases the complication rates, and also ensures that you have smooth and consistent results after a period of 6 weeks. So a minimum of 10 to 15 sessions starting on the post-op day 4, going up to post-op day 30 if you're doing on alternate days, or if you're doing continuously, then about post-op day 14 or 15 are absolutely essential in ensuring that you get the best results. So these are some of the most critical and important factors in the recovery of a lipoabdominoplasty. In a nutshell, you should be walking around the next day. In about 2 weeks, you should be able to go out and carry your daily work. In about 6 weeks, you should be able to hit the gym. If you want to travel, then I would advise that at least 2 weeks between your procedure and the travel date. Thank you.